Hi, this is Mary Jane Ilozor, and I'm here to discuss about your well-being using the book Influence of Media on Public Health by Mary Jane Ilozor. This book has a lot of compiled case studies that has been dished for you. When you dish a good content, you know how to, you know, push it out there because you know what you have in it. This book has a lot to do with recommendations, suggestions, and citations from World Health Organization, some UN organizations, UNICEF, and other international healthcare organizations, which might interest you to know more by getting a copy from Amazon.com and other links out there. Just search for it. So, in digging deep on the insights about the book, Influence of Media on Public Health, there are recommendations and acknowledgements by people who are very important to listen to, like the person that talks from the angle of the media, Engineer Vincent Maduka. You know him from uh, NTA as the retired Director General, Nigerian Television Authority. And he has spoken from the angle of the media about the book, how essential it is to the society, the media, the healthcare institutions. We, knowing that the media are the ones the society depend on in terms of disseminating information on their well-being, not really the doctors. We search for information from the doctors, from healthcare institutions, from researchers on healthcare, and we compile to put it out there for your own consumption. So we have another person who talks from the angle of pharmaceutical sector. That's Emeka Onodugo. He has spoken saying the book is a must read by anyone who takes care of his or her health and well-being. We have another person from the government. That's Honorable Nze Ogochukwu Vincent Okpara, MD. That's the Commissioner for Health, Anambra State. The past Commissioner for Anambra State. So, from their recommendations, you are sure of this book being something that has to be in your shelf whenever you need to look at what is going on around you concerning your health care and how to go about it. You take it up and read, and if there's any way you can disseminate or share the information with others to gain from what you have read, that's very, very encouraging and motivating to do. So, in this book, Influence of Media on Public Health, people are guided on ways of disengaging from anything that can cause infection, any outbreak, any kind of pandemic, and even if by chance there is one, ways of eliminating it from the system in any community that is affected are provided in this book. The recommendations of how you will take care of your health and live well, because we know health breeds wealth, health breeds happiness, health breeds communal living, harmony, joy. With you being healthy, there's nothing you cannot achieve in life. That's the basic. We talk about business, we talk about our knowledge of reading and understanding. If you are not healthy enough, I don't think you can fetch what you're seeking. So let's first of all do the fundamental things that matter, which is our health being, our well-being. Okay, we are looking at the insights of the discussions on this book. We talk about politics pushing away healthcare content from being heard, being noticed, being focused on, until when there is infection or outbreak, everybody starts looking for media, the traditional media, this time not the social media, the traditional media, to gain the facts, the informations they need. It is advisable, fine, to search for information from the traditional media. It is also advisable that we will always be equipped with knowledge of what is going on around us, not waiting till the late hour, the 11th hour. So, in influence of media on public health, the citations from WHO on some of their case studies, like the one discussed about the COMBI, some of the insights on how to curb some diseases in some certain communities, some recommendations and citations from UNICEF, from other organizations, from media as well on healthcare are discussed in this book. Why you need this book is there are kinds of non-touched topics that has not been discussed from my own investigation and my little observation. So it pushed me to write this book, because I know that when we don't touch these angles, these aspects of our well-being, they are eating deep in the system, and it is affecting our society, the global community. So someone has to talk about it. And it's not just to talk about it, but to share it, make sure that it penetrates to be heard, for people to know the issues going on healthcare sector, on the media sector, even some of the recommendations that the government need to follow suit by advising and recommending that individuals should follow this way to achieve the better healthcare. So we, the researchers, have gone so deep to find facts that you will need for you to live well. And it should not just be finding facts and dumping them. Someone has to look at it, someone has to read them and follow the prescriptions on them for us to avoid a massive affection of diseases, which has happened in the past. And currently, the recent cholera discussed in some parts of African countries is also another discussion you will find from the book here, which gives you ways of disengaging yourself from being infected by outbreak, infections like that. Not only about the recommendations of the book, we will also advise that if you have enough to extend to people around you, you can take a copy and give it as a gift to your medical doctor. They will appreciate it. Especially now that we are about to have our Christmas. It's a good gift, if you ask me. If you give your medical doctor or anyone you care about who wants to be acquainted with what's going on around him or her on health care and about the healthcare organizations and recommendations from other sectors which are compiled in this book, it will be a boost of your relationship with the person. Why? Because it is evergreen in the shelf, and they will look at the book and remember how much you care for them. This is all I have for today, and more will come your way soon. Thank you for listening, and thank you for your time. Be good and good and good. Take good care of your health. Bye.